Hello and welcome. In this short video we're going to talk about the ideal properties of local anaesthetic. Now what we do is, because there's actually a large number of ideal properties, we actually cluster them into four fundamental groups. Group 1 is general drug properties. General drug properties. Group 2, we collect those together into the topic of safety. Group 3, we cluster them up into properties about the action. And then the fourth group is sort of the other properties that we want as well. Now, the reason we talk about properties of local anaesthetic is really to allow us to understand what we need to put into a drug, and can we have one drug to do this. So in other words, these ideal properties give us the opportunity to look at and test new drugs and decide whether they are good local anaesthetics or not. So let's start working our way through these ideal properties. Let's start with general drug properties. So within the general drug property group, within this group, we have about 4 primary properties. And the first property we talk about is that we don't want this to be toxic. So whatever drug we choose needs to be non-toxic. And that makes logical sense. You don't want to be injecting something or rubbing something on someone that's going to have any toxic side effects to them. The next property is that we want it to have a high therapeutic index. And what a therapeutic index means is it's really, the index is a ratio of the amount needed to get the action you want versus the amount that can cause damage. So it's action over damage. And clearly, the higher this therapeutic index is, the safer the drug is. So, for example, a drug with a therapeutic index of, say, 10 means that you need to give 10 times the dose to cause trouble to someone than you do to actually get the effect. Clearly, there are some drugs in the world who have a therapeutic index of just 2. So, in other words, if you take 1 tablet, it does you good, but if you take 2, it can cause you significant damage. So these drugs are very carefully monitored and looked after. So in our case, for local anaesthetic, we want something with a very high therapeutic index. We also want something that is non-addictive. Now, that's clearly the case. We don't want our patients or ourselves to become addicted to some local anaesthetic drug. Now, the irony in this story is the very first and one of the best local anaesthetics is actually cocaine, that we all know has a significant addictive component to it. And the last of these general drug properties that we need to think about is that we want it to be sterilisable. We want to be able to heat this drug, or we want to be able to irradiate this drug, or in some way to sterilise it without the drug losing its normal properties. So these are the 4 major properties under the general drug properties heading. Let's talk about the second heading, and that second heading was about safety. So the second heading was about safety. And that has 2 sub-properties to it that we talk about. Firstly, we want it to be non-irritating. In other words, we don't want this drug, if we were to inject it, to cause inflammation or to cause damage to muscles or cause any irritation to tissues. And the second one is we want it to be non-allergenic. Now, modern local anaesthetics, as in the gold standard local anaesthetic, lignocaine, the rates of allergy to that molecule are estimated at about 1 in a million. So it is a very non-allergenic molecule. That's not always been the case with local anaesthetic. One of the early local anaesthetics, procaine, has a very high rate of allergy to it, and in fact in the early 1900s many people would have lost their lives through the use of procaine and their allergic reactions to it. So these are the two key safety properties that we look for when we're looking at local anaesthetics. Let's now look at the third group, which is the group about actions. And there's a series of 4 properties under the actions heading. The first is we want the action to be specific. In other words, we want the action to actually cause the cessation of action potentials running down a nerve. We don't want it at the same time to stop blood flowing or have any other peripheral effects like that. So we want the action to be highly specific to doing the one particular role. We also want the action to be reversible. Clearly, we want our dental patient to come in, have their local anaesthetic, and then the local anaesthetic to wear off and they go back to being normal again. We also want the local anaesthetic to have a rapid onset. It's no good if this drug we have to inject in the mornings and it doesn't work until the afternoons. That would make it very difficult to undertake dental care or any other sorts of care that needed local anaesthetic. So we want the onset to be rapid. And the last property in this group of properties is that we want it to have a duration, a known duration of action. And I also include in known a stable duration of action. We don't care if this local anaesthetic is only active for 15 minutes. We just need to know that that's the length of time we've got to work with. Alternatively, if this local anaesthetic is going to be working for 3 hours, we just need to know that so we can tell the patient to be careful when they go home because it's still going to be active. So these are 4 major properties of an ideal local anaesthetic drug around the action of it. The last set of ideal properties is the sort of catch-all group for being the other properties. And under other properties we have all sorts of interesting sub-properties. For example, we want this drug to be active if we inject it or if we apply it topically. In other words, we want a drug that we can pick up, inject into someone and it'll work effectively against nerves, but we also want it to be effective if we get it into a gel and we rub it onto the surface. So that's really important. We also want the drug to be vasoconstrictive. And we'll talk about this in a separate video, but being vasoconstrictive means that the drug will reduce the diameter of peripheral blood vessels, and thereby the drug will stay in the area for longer and have its effect for a longer period in that area. But more importantly, the drug will only get back into the circulation slowly, and that means that the risk of a bolus of drug hitting major organs of the body is significantly reduced. So being vasoconstrictive is a good safety measure. We don't want this drug to cause any permanent damage. In other words, we don't want this drug to, say, cause muscle to go necrotic or anything like that. We want this to be a tissue-friendly drug. And the last ideal property is that we want it to have a long shelf life. Now that doesn't mean that's not a property just because it's a nice property for sales and things. There are many countries in the world where there isn't good refrigeration, or there's high temperatures or low temperatures or all those sorts of things. And we want local anaesthetic to be effective really in any way that it's stored, be it it's in sunlight or in the dark, or we want it to be a very robust chemical, or we want it to be stable is another word I would use. So we want this local anaesthetic to be effective anywhere we want to use it. Alright, so to summarise, we want this drug to have multiple properties. Now, the news around this is not good. There is no individual molecule that has all of these multitude of properties. So what we do with local anaesthetic is we actually add a series of different drugs together. For example, we add a little bit of analgesic to give us all those properties that we want. We want it to reduce the flow of action potentials back to the brain. We add some chemicals as ions, so we can make it osmotically stable, and therefore it will be friendly to tissues. We add some preservatives to give it its long shelf life and make it stable over time. We also add some vasoconstrictor to give us our vasoconstrictive properties. So overall, what you see in a local anaesthetic carpule of drug an LA carpule actually has a whole sequence of elements within it, different molecules, to give it the set of ideal properties that we are looking for. Thank you.